Hello, everyone, and welcome to this series. We're going to be talking about vaginal and bladder changes that many don't talk about. So maybe you're in menopause and you've noticed something feels different down there. Or maybe you're in your 30s or 40s or even 50s. You're not yet in menopause, not officially, but your vagina feels dry, intercourse has become uncomfortable or even painful, and you're wondering what's going on. And some people say, oh, you're just getting older, but you feel like there's something more going on there. Well, you may be right. Hi, I'm Dr. Lola Ashaye, and welcome to Connecting the Dots with Dr. Ashaye. I'm a board certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. If you are ready for more clarity about your health, this series is for you. But be sure to subscribe, share this episode with someone who needs it, and because this is good information that can really, really make a big difference in their lives. So, in this first episode, first of four, we're going to be breaking the silence around changes that occur. A lot of them are hormonal, and what some people are experiencing is called genitourinary syndrome of menopause. However, it doesn't only happen during menopause, and we're going to talk about that. So, as we know, menopause is a time where there are a lot of hormonal changes that happen. And I did a whole series on that last month. So if you haven't already looked at that, go back and look at our YouTube channel. We have a four-part series about changes that can occur during menopause and all the hormonal shifts and what you can do about it. But today and the rest of this month, I want to talk specifically about how those hormonal changes can affect the vaginal and bladder symptoms that a lot of people experience. And one of the things that some people don't realize is that the low hormone levels can occur not just only during menopause, but in other time periods. So, for instance, some people that take birth control pills will experience similar symptoms, and that's because when you take birth control pills, it actually shuts down your ovaries and replaces your hormones with synthetic hormones. So it replaces, you get estrogen and progesterone at high doses, but synthetic forms of it. And because now your ovaries are no longer producing natural estrogen and progesterone, some people will actually have symptoms, vaginal and urinary symptoms from that. Also, people that take other medications like spironolactone. So spironolactone is a medication that is used for acne and sometimes used for PCOS, polycystic ovarian syndrome. It's actually an anti-androgen, so it blocks the effects of androgens like testosterone, and that medication can also cause people to have some side effects like vaginal and urinary side effects because they no longer have the natural, they're blocking the action of androgens, which are helpful also for vaginal health. Also, infertility treatments can can cause hormone shifts. Breast cancer treatments like tamoxifen or aromatase inhibitors can affect hormones as well and can cause shifts. Eating disorders or significant weight loss can cause hormonal shifts. Surgical menopause, if they remove ovaries for whatever reason, that can cause hormone changes as well. Also, breastfeeding is another time period where hormone shifts occur. So during breastfeeding, prolactin, a different hormone, is secreted to allow for breast milk production. However, prolactin also lowers other types of hormones which allow your ovaries to produce estrogen and progesterone. And so there's usually a lower amount of estrogen and progesterone when you're breastfeeding, and so it can cause vaginal and urinary symptoms. So, what are symptoms? Okay, so this hormone shift, like I said, can cause vaginal and bladder changes. Sometimes it causes vaginal dryness, it can cause burning or itching, it can cause pain during sex, it can cause dryness where there is no lubrication, it can cause the feeling of tearing or tightness, it can cause light bleeding after intimacy, and it can thin the walls of the vagina. Also, People can have urinary symptoms where they have urinary frequency, where they feel like they have to go to the restroom often, where they feel burning with the urination. Sometimes they notice they're having more urinary tract infections. Sometimes they feel like they can't hold their urine as well as they used to, or that they easily leak when they cough or they laugh. And some women will just have one or two symptoms. Others will experience all of them or most of them. And so it's important to know that there are hormonal shifts that can cause the symptoms so that you can know if there's something you can do about it and get to the root cause of it and treat it. So if you keep getting yeast infections or UTI symptoms, it's important that hormonal shifts are considered as part of what may be going on and that you're not just being treated over and over and over again for these symptoms without getting to the root cause, because it may be related to hormonal shifts and that needs to be addressed as well. So what can you do? Well, number one, start paying attention to your body. Note the symptoms, journal them, try to figure out if there are any kind of cyclical patterns to your symptoms, but try to keep track of what is going on in your body, especially around your cycle. And notice if you add any medications or stop any medications, if it makes a difference, and see if there are any life events that may also be affecting and causing symptoms. And when you know what your symptoms are, then you want to talk to a person that is aware about menopause or hormonal changes and see if they can help you get to the answers. But for now, start working on looking at symptoms, seeing if those symptoms may be hormonal related. And if you think they are and you're in the Texas area, come see us. And otherwise, keep listening. Find somebody in your area that you can see. Keep listening, and we're going to be talking more about what you can do about this in our next episode. If you found this helpful, go ahead and subscribe, share with a friend, a sister, a co-worker, and we will see you next week.